In this video, I'd like to share a few tips as it pertains to scheduling OR days. Now, your OR should run as smooth as possible, and that comes with appropriate planning. So, tip number one. If at all possible, just only do right eyes that day or only left eyes. So if you've got, as an example, 16 cases, schedule all 16 cases to be all left eyes as an example, or as all right eyes. Now you might say, that's not practical to book all right eyes or all left eyes, but believe it or not, some surgeons do that, and I actually try my best to do that. What is the benefit of having all right eyes days, all left eye days? Well, you will appreciate it, and the nursing staff will appreciate it, and your admin staff will appreciate it as well. From a surgeon standpoint, there's less risk of error. What do I mean by that is all patients that day are getting their left eyes. You don't have to worry about switching back and forth right eyes to left eyes. The nursing staff appreciate it as well. And the OR setup, you don't have to change the setup when you go from right eye to left eye, rotating the microscope, rotating the handles, rotating the foot pedals, things like that. So tip number one, if at all possible, stay on all right eyes or all left eyes. Again, can be difficult to do, but believe it or not, some surgeons strongly abide by this, and when possible, I try to have my days like this. So that's tip number one. What about tip number two? So tip number two is, if you can't have all right eyes or all left eyes, well then minimize the number of times you switch eyes. Okay? So what do I mean by that? Well, if I use the 16 cases a day as an example, 16 cases, well, the first 8 and then the second 8 should be, as an example, right eyes, and then all left eyes. So this is, in this particular setup, you're only switching eyes once. What you don't want to do is constantly switch. A couple of cases left eye, a couple of cases right eye, then right eye and left eye. As I said, it increases the risk of errors, consumes more time from the nursing staff of changing things around, and it just affects the flow, okay? So tip number one is try to keep all the eyes the same that day. Tip number two is if you can't, minimize the number of switches. And now tip number three is what I call the Shasha safety step. Safety step. Okay? And this pertains to when you have to switch. So if for example, if we've got 16 cases, the first 8 are right eyes, and then the second 8, the second group are all left eyes. As you're switching, so here's patient 8, here's patient 9. So patient 8 is a right eye. Patient 9 is a left eye. Make sure that patient 9 is a second eye. This is an added safety measure to know to switch eyes. What do I mean by that? Well, for whatever reason, let's assume the nursing staff, there's a mix-up, and after patient 8, you forget after patient 8 to switch sides. And so by the time you get to patient 9, if there was forgetfulness on switching sides, it's impossible to operate on the right eye for patient 9 because the right eye has already been done. And so you know to switch sides. And then the rest of the day is otherwise straightforward. So this is what I call the safety step. When you do make changes, have the first patient on that switch, if possible, be a second eye. Okay, and that just gives you another reassurance as a reminder to switch sides. Now, it's always good to have as many checkpoints as possible, but those are my 3 basic tips when scheduling OR days. Again, limit the number of swaps if at all possible. Keep it all right eye, all left eye. If not, minimize the number of transitions. So 8 right eyes, 8 left eyes as an example. And then tip number 3 is when you're switching sides, the first patient, have them be a second eye. Hope you found this to be useful, and thanks for watching.